I put together some x-rays from a PennHip study we did to show you guys what we look for when we do these x-rays. So this is that first shot, that hips extended. You can see the legs are stretched out in front of the dog, and you get a square shot of the pelvis to see how the head of the femur fits into that acetabulum, that hip socket, as your baseline for any signs of poor conformation, early arthritis, anything along those lines. The next two shots, like we talked about, are specific to PennHip, and they revolve around laxity. So this is that compression view. You manipulate the legs so that the knees are bent over the dog, just like if they were standing or walking, to fully seat that femur into that socket so that you get your baseline of where are you starting. And then the next shot is that specific distracted view that we use the distractor for, to see how much laxity can we get with a little bit of pressure on these hips. And so it's that same positioning as the last x-ray we took. The difference is that the distractor is placed over the hips. And so you can see here where the plastic is of that distractor, and then the foam on the outside, and as the foam gets compressed as we put pressure on it. And then you can see here that these hips are feeling the distractor. It's not painful by any stretch, and it does not drastically move these hips out of the socket or anything like that, but you can see that there's a little bit of movement with that mild pressure, moving these head of the femur out of that socket a little bit. And so you, as a comparison, you can see the before on the left where those femurs are really in those sockets, as opposed to that mild pressure, moving the head of that femur out a little bit. And that is that second part of hip conformation that we look at, which is the extent of laxity. Like we already talked about, there'll always be some laxity. The question is how much, and that's why we do this procedure. So these were a couple of other dogs we have done. On the left, you can see this dog's hips have very, very minimal laxity. You can see that foam is really compressed. This actually hurt me taking these images because this dog's hips were that tight. But that's great for the dog. He has very minimal movement in either of these hips. And then the dog on the right actually came to us for limping on his hind legs. It was an older puppy, which is why we did the PennHip. So you can see left is potentially breeding, right is some of our therapeutic uses of PennHip, to see how much laxity there is with that dog. And so you can see that this dog had some movement with these hips. There was a decent amount of movement in both of those hips, which tells us that he had a looser conformation that can cause some discomfort for that dog and put him at some risk of arthritis in the future. When you get the report from PennHip, they will give you something along the lines of this template. And so this is a report from a different dog, but just for your purposes of what that report would include. It gives you the distraction index of both hips. So that is a 0 to 1 score. 0 is no laxity, 1 is 100% laxity, and then you can have anything in the middle. This gray box down here is specific to your particular breed. And so for this breed, the range of dogs when they do PennHip fall within this gray box. So somewhere around like 0.22 to 0.66 or 0.68, roughly. And the average for that breed is that 0.4. This particular dog was a 0.43, that green line, so it shows you a little bit above average for the breed, still well within the range of that breed, and puts him at a mild risk for arthritis. Based on what that distraction index is, there's low, mild, moderate, or high risk of developing arthritis. Interpreting these reports can always be a little bit complicated, depending on your particular case, and that's something that certainly we'll talk about when we get that report, is how do we apply this to your dog, whether it's that they're clinical for hip issues, or if this is part of a breeding program, how do we apply this dog for improving the hip conformation in the kennel, anything along those lines. And so that's something that certainly we'll talk about pending the report from PennHip.